Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology, and today's topic is SMA, Spinal Muscular Atrophy. This is a condition you can tell from the name affects the nerves of the spine, but it also affects the muscles. The nerves of the spine with this genetic condition are missing a very important protein called survival motor neuron protein. This protects the nerves and allows them to do their job. But when a baby gets a gene from the mom and a gene from the dad, which prevent them from developing this survival motor neuron, then the muscles of the body cannot get signal. It affects the skeletal muscles, so usually these babies can't move. It affects the muscle of the diaphragm, so these babies can't breathe, but it also affects the muscle which allows for swallowing. So shortly after delivery, a lot of times these babies have to have a tracheostomy so they can be hooked up to a breathing machine. They have to have a feeding tube in their stomach to allow them to get nutrition. And sadly, these babies will usually die by the age of 2. Well, there was a medication that was developed called risdiplam. And risdiplam was showing great promise when it was given to these babies after delivery to help them protect the nerves and the function of the muscles. Well, the doctors at St. Jude's thought, what if we were to give this new medication to the mom while she's still pregnant? Well, with 6 weeks left to go in the pregnancy, that's exactly what they did. They had diagnosed this baby because the couple had a previous baby that was diagnosed with SMA, and sadly that baby passed away a little bit after delivery. Well, they got pregnant again. They had already tested mom and they already had tested dad, and they found that they were both carriers. So then they wanted to test the baby as well. So they did an amniocentesis where they took a needle, passed it through the skin of the mom, passed it through the wall of the uterus, collected some fluid, tested it, and yes, they diagnosed this baby with spinal muscular atrophy. And so they knew the baby was a carrier of this condition. Well, yes, it's amazing that we can even diagnose it, but they thought, well, if we can give the medication after the babies are delivered and it really helps overcome some of the symptoms of SMA, why not give it to the mom the last 6 weeks of her pregnancy? Will that make a difference? Well, that's exactly what the doctors at St. Jude's did. Well, the baby is now 2.5 years old, shows no evidence of SMA, even though they have confirmed that the baby has a gene from the mom and a gene from the dad, and this baby lacks survival motor neuron protein. It's just one more example of how we don't just diagnose, we don't just treat, we are now curing babies in the womb, and all patients have rights, and a patient is a person, no matter how small. We are now giving life-saving blood transfusions to babies in the womb. We have done that at my hospital as early as 18 weeks gestation. We are now doing open heart surgery and removing tumors called teratomas from babies' hearts at 27 weeks gestation at different centers around the country. And not only are they performing open heart surgery on these babies, they even have a separate second anesthesiologist that starts an IV in the baby's hand, and the baby is getting pain medication, fentanyl, and also receiving a paralytic called Norcuron. But we are doing vascular brain surgery for babies in the womb. We're doing laser vascular surgery. We are now in our 3rd generation of treating spina bifida while they are still in the womb to cure this condition which affects the spine and all the muscles from that point down on the spinal column. A patient is a person, no matter how small. All patients have rights, and we are created in the image of God at the moment of conception. So defend the image of God in the womb, which are my patients. Yes, the moms are my patients, but the babies in the womb are my patients as well, and all patients have rights. There are new advances in fetal procedures, not just diagnosing, not just treating, but actually curing babies in the womb, and these new advances come out every month. This SMA therapy and cure was just listed in the New England Journal of Medicine. You can pull up that article yourself. Just look at New England Journal of Medicine and SMA. God bless you all. Thank you for defending God's preborn. We have a duty to do what is right. If you have any questions, you can contact me through my website, which is prolifedoc.org. I'm Dr. Bill Lyle, and have a blessed day.